Now once we have read about the common malabsorptive syndromes, now let's come to some unusual ones, and these are the ones which are asked to you in exams. Okay, so what are the unusual malabsorptive syndromes which can occur? So first of them is called Abetalipoproteinemia. Abetalipoproteinemia. Okay, so this is Abetalipoproteinemia, which we have to know. The second one which everybody has to understand and know this is that there can be some parasites, okay, which can cause malabsorption. So in small intestine we typically have Giardia. So Giardia is also picked up on duodenal biopsy. So if you do duodenal biopsy, you will be able to identify Giardia. Okay, so Giardia. Apart from that, we can also have Cryptosporidia, which is usually seen predominantly in the ileum, but it can affect colon also. So usually it can be seen in ileum, and this is usually seen in the duodenum. Okay, so small intestine biopsies, okay, duodenal biopsy will show you Giardia and ileal biopsy will show you Cryptosporidia. Although Cryptosporidia is also very common in the colon, so it is also an important cause of colitis. So we have to know these unusual because they are the frequent questions which they ask you in exam. Okay, we should be knowing this. In small intestine, so here it is the infections of they are the malabsorptive conditions of small intestine. Okay, and then we have large intestine parasites which are different. Okay, so these are small intestine parasites which can be seen in small intestine typically. Okay, right. So when we talk about Abetalipoproteinemia, it's a very simple disorder. Okay, so what happens in Abetalipoproteinemia? Name itself says Abetalipoproteinemia because there is no lipoprotein B. Okay, Abetalipoproteinemia. So what happens here is there is a defect in microsomal triglyceride transport protein. Okay, so there is a defect in microsomal triglyceride transport protein. So can I say it? MTP. That's what is commonly given to you in exam. It is a MTP defect. It is a MTP defect. I hope you understand what is MTP now. It is a microsomal triglyceride transport protein defect. So because of this, the lipoproteins are not being transferred from the GIT. So they start accumulating in the epithelium of the GIT itself. Okay, so they are not being transferred properly, and so absorption doesn't occur properly. So if you look at the small intestine like this, I'm going to show you the image here. Okay, so that's a very characteristic image that they give you in exam. Here all the epithelial cells of the intestine, okay, especially the villi of the small intestine, they become vacuolated. They all become vacuolated because they're loaded with lipids. Okay, because these lipids actually were to be transported out from the GIT to the other parts. Okay, but this is not transported out because of the transport protein defect. So if you put oil red O, this will come out to be very beautifully positive. So all the epithelium is lipid laden and it will be positive for oil red O. So that's what you can see in Abetalipoproteinemia. And I hope you remember in hematology we have already discussed. Here you can also see acanthocytes. Okay, in the peripheral blood, here you will be able to see acanthocytes. So acanthocytes can be seen in the peripheral blood here. Okay, so acanthocytes in the peripheral blood along with presence of lipid in the epithelial cells should make you think of Abetalipoproteinemia. Abetalipoproteinemia. Everybody clear with this? Yes. Now let's come to the parasite. So first parasite that everybody should know in the small intestine is Giardia. Okay, so Giardia should be your favorite and you should be knowing it. You should be able to identify it anywhere. Okay, so let's see the Giardia. Okay, so Giardia is a typically pear-shaped organism, which you can see, pear-shaped organism, and this organism has a very typical thing. You have to see the two eyes. So whenever I talk about pear-shaped organisms, I have two differentials which should always come in my mind. Either we are dealing with Giardia or we are dealing with trichomonas. Okay, we are dealing with Giardia or trichomonas. Okay, so these are the two differentials that should come into your mind whenever you see them. Okay, so how do you differentiate them? Okay, so trichomonas, okay, it is like trichomona. That's the code I always remember. It is like trichomona. So if you see trichomona, she is winking her one eyes and has a very beautiful hair coming here. Okay, undulating hair coming in. So this is trichomona who has only one eye because one eye is winking close. And Giardia is like a staring boy, okay, so he's staring, he has two big eyes like this, so he's staring, and he has lot of mustaches also, okay, so like this. So Giardia is like a staring boy, so he has two big eyes and lot of mustaches coming out, okay. So can you see this? That's your Giardia. So on the small intestine, so that's what typically you see like this, okay, so staring boy like this, okay, staring like that, okay, so this is very typical Giardia, okay, with lot of mustaches coming out like this. So these are Giardia. Remember, trichomonas we will see in the genital system. When we study the genital system, we will see in the pap smear, okay. So trichomonas in the pap smear. Giardia can cause malabsorption. Both are beard shaped. You should know how to identify them. Two eyes is Giardia, one winking eye is your trichomona, okay. So that's your Giardia versus trichomonas, which everybody should be clear. Now let's come to the Coccidia, okay. So let's see which are the different type of crypto infections. So we have cryptosporiosis, which is usually seen in ileum, but it can also be seen in colon. So first let me tell you that there are a lot of Coccidias which can affect the GIT, and typically they cause colitis. Okay, so we'll be studying it here itself so that you remember it when it comes in exam, and this was your AIMS question which came last year. Okay, so everybody has to be clear. So I'll show you one diagram first. Okay, so let's look at this diagram first. So if you look at this diagram, so there are two typical Coccidia which can affect. Okay, so there are four typical Coccidias which can affect your GIT. So four different organisms which everybody has to be clear. So remember, the names are quite similar, so you have to be clear about it. Cryptosporidia number 1, Microsporidia number 2. So there are two Sporidia, okay. So there are two Sporidia, I've written it on the separate side, okay. So Sporidia, because they are very small. So Cryptosporidia and Microsporidia, okay. So first we'll clear these two, okay. So now Cryptosporidia could be hominis or could be parvum, okay. So we have Cryptosporidia parvum or Cryptosporidia hominis, okay. So we have two types, okay. So usually when we talk about this, we typically talk about Cryptosporidium parvum, okay, but hominis can also infect, but parvum is common. Now when we talk about Sporidia, let's see how it is there. So Sporidia is usually small size. So Microsporidia means very, very small. So this is usually only 1 to 2 millimeter, very, very small, micro. So it's micro, only 1 to 2 millimeter. So start with the number 1, micro, 1 to 2 millimeter, very small. And these small enter into the inside the epithelium. So they are seen inside the epithelium. They are inside the epithelium and they're very small. Sometimes you cannot see them with naked eye. So you have to pick them up by so they are Zn positive, all these are Zn positive. You can see Zeal-Nielsen stain positive. So Microsporidia is so small that sometimes they are missed. So you have to see it by polarizing microscopy. So if you see them with polarizing microscopy on Zn stain, they will start shining, okay, inside the epithelium. Okay, now crypto. See, crypto, C is the third word, A, B, C, okay. So C is the third word. So just after 3 is 4. So they are approximately 4 to 6 micrometer, okay. So or you can remember 3 to 6 micrometer, okay. So they A, B, C, so that's the third alphabet. So 3 to 6 micrometer. So they are usually 3 to 6 micrometer, which you have to remember. Very small, 3 to 6 micrometer, okay. So that you have to remember. That is your Cryptosporidia usually 3 to 6 micrometer, everybody has to remember, and it stays in the brush border. It stays in the brush border. Can you see here? So it will be seen in the brush border of the epithelium. So they are blue colored spores sticking to the brush border of the epithelium. So they are sticking to the brush border of the epithelium. That's what they show here. So because whenever they also stick to the brush border, blue color small spores. How much is the size? 3 to 6. Now we come to little bigger spores. So bigger spores are called spora. So this was Sporidia, they are spora. So we have two spora, cyclospora and isospora. What are the two spora? Cyclospora and isospora. So let's talk about them. Okay, when I talk about cyclospora, okay, so cyclospora and isospora. Obviously, if you go by alphabetically, C comes early. So C will be smaller, I comes later, so I will be bigger. So A, B, C, D, E, F like that. So cyclospora is small, isospora is big. Spora means bigger spores, okay. So when we come to cyclospora, these are approximately 10 micrometer in size. So they are bigger. Okay, so sporidia is small, very small, 3 to 6 micrometer. Cyclospora is 10 micrometer. Okay, 10 micrometer in size, and normally they can divide, they can show sporocyst, and you can see various stages of development. Somewhere you can see 2 spores, somewhere you can see multiple sporocysts inside. So they also enter inside the epithelium, and you can see various stages of the development, 2 spores, 3 spores, like that, and they are bigger in size. They are 10 micrometer. Now the largest of all is isospora. Okay, iso is the largest, 30 micrometer. Okay, so they are very large, 30 micrometer in size, and they are usually oblong. Okay, then round, they are oblong, and they also enter inside the epithelium. Okay, they also enter inside the epithelium, but they are larger. Okay, so majority of these infections occur in HIV positive infected people, and these usually occur whenever the person is immunocompromised. Okay, so remember everybody again, which sticks to the brush border, it is cryptosporidium, which sticks. Okay, all 3 enter inside, so they are differentiated by their size. Micro is the smallest, 1 to 2 micrometer. Okay, and then there is cyclospora, which is 10 micrometer, and then we also have isospora, which is biggest of all, which we can see. Now once we are clear with everybody, now also you have to understand one more thing here, that these can be seen by modified Ziehl-Neelsen stain. So this modified Ziehl-Neelsen stain method is called Kinyon method. Okay, what is this called? Kinyon method. This was your AIIMS question that came last year. So let's look at the AIIMS question. So let's see if we can answer that. Okay, so this was the question that came. This is an HIV positive person who has got diarrhea on Kinyon stains. Kinyon is a modified ZN stain. 4 to 6 micrometer oocysts were seen. So these are coccidias or oocysts are seen okay, so they have not given whether they are sticking on the brush border or they are inside the epithelium. Nothing has been given, but the size has been given, 4 to 6. I hope now you should not be having any doubt. You know, here the options were very, very simple. So now I just to confirm that you know that we have microsporidia and we have cryptosporidia. Okay, so they are sporidia, so they are small. When we come to bigger ones, we have cyclospora and isospora. Okay, so my pen is not working somehow. Okay, isospora and cyclospora. So microsporidia is 1 to 2 millimeter, usually 1 to 2 millimeter. Okay, cryptosporidia is usually 4 to 6 micrometer. Cyclospora is 10 micrometer. Isospora is 30 micrometer. So I hope you know the answer here is cryptosporidium. Okay, Giardia doesn't look like that. Giardia is a staring boy with 2 big eyes. Okay, cyclospora, you know, it is a 10 micrometer spore, bigger one. Valentidium coli doesn't look like this at all. Okay, so is everybody clear with this? Yes. So now let's look at the images of each one of them so that we can be able to identify them. Okay, so starting with the first one here. So can you see this is the epithelium, and can you see this very, very small spore here inside the epithelium? Very, very small spore. It is very difficult to see the spore. Very, very small spores inside the epithelium here, 1 to 2 micrometer present inside the epithelium. So what is this? This is your microsporidia. What is this? Microsporidia. Okay, and I told you, if you want to document this inside the epithelia, you have to put Kinyon stain or ZN stain, and you have to see them under polarizing microscopy. So if you look them under polarizing microscopy, all of them will be shining. Okay, so they are refractile on polarizing microscopy. Okay, now let's look at the other one. Now identify this parasite. Can you see this? So this one is a very small spore, but it is sticking to the brush border. So once it's sticking to the brush border, it has to be cryptosporidium. So they can give you various images of the cryptosporidium. See this sticking to the brush border. Okay, so 4 to 6 micrometer has to be cryptosporidium. Okay, again, can you see this sticking to the brush border like this? Has to be cryptosporidium. So 4 to 6 micrometer sticking to the brush border, basophilic in color. This is your cryptosporidium. Everybody clear with this? So once we are clear with the parasites which are seen, now a spotter for you. You identify this. What is this? So low power showing you these villi. Can you see this? These are villi, and the crypts below has to be small intestine, and in the small intestine you can see these some organisms here. Okay, these organisms they are freely floating like this. So they are these organisms are actually Giardia. So remember, Giardia is actually like this, okay, but when it comes in the biopsy, this usually fold upon themselves. So they usually fold, so they are like pear shaped, but they fold upon themselves, and when they fold upon themselves, they start appearing like a sickle. So that's the clue to pick them up. So they start appearing like a sickle. So whenever you start seeing sickle cell like structures over the top of the villi, that should make you think of Giardia, okay. And remember, Giardia decreases the expression of lactase on the epithelial cells, but they stick to the brush border, okay. So they have the power of sticking to the brush border. So they are usually sticking to the brush border, not so strongly as your Sporidia. That is why I am showing you this image after that, because now you have seen Cryptosporidia or Microsporidia, okay. Cryptosporidia sticks to the brush border, so they also have a power to stick to the brush border, okay, but they are not very tightly stuck like that, okay. So they also can stick, and they can decrease the expression of lactase, okay, by the epithelial cells, but usually you can see them little bit free from the epithelium, little bit away from the epithelium, and they usually appear sickle shaped, okay. So let me show you the high power. So if you look at the high power, see, these ones are the intact. Can you see this? This is here with two eyes here, so this is intact, okay. This also you can see with two eyes here, so that is intact one. But look at this one, see, it is folded upon themselves. So when they are folded upon themselves, they appear like sickle, okay. So these are sickle. So can you see, these are Giardia here, okay, and can you see this here one also, it has two eyes like this, and they are all sickle shape, they are all the normal Giardia, but when they fold up, they can fold upon themselves and they appear sickle shape like this, okay. So that is also typical of Giardia, okay. So let's see one more image here. So can you see this epithelial cells here, but just over the epithelial cells you can see this, can you see this sickle shaped cells, okay. So like this, so they are actually folded Giardias, they are all folded Giardia. That is how a Giardia appears on the intestine, okay. That's how you have to identify Giardia in the GI biopsies. Everybody clear with this? That's your Giardia, okay. So to recapitulate quickly, what have you studied as the unusual causes of the malabsorption then? You have remembered there can be Abetalipoproteinemia, where you see vacuolization of the epithelial cells, and then you've seen the parasites in Giardia appear sickle shape. Cryptosporidiosis, which is seen in the small intestine, is usually attached to the brush border. Others usually affect large intestine and they cause colitis, and usually they are seen with HIV infections. So usually they are seen with HIV infections, okay. So that is very, very typical feature which you have to remember, okay. That's the unusual ones, okay.